Another organ affected by diabetes is the kidneys. Diabetes is the leading cause of kidney failure in Canada. 50% of all people with diabetes will experience signs of nephropathy in their lifetime. Kidney disease is also strongly associated with cardiovascular disease, another complication of diabetes. Nephropathy refers to damage to the small blood vessels in the kidneys. This leads to two phenomena: a decline in their ability to filter the blood, and the abnormal excretion of certain substances such as protein in the urine. The primary role of the kidneys is to filter the blood. The kidneys retain the elements that are useful for the body and allow excess substances such as sodium, potassium, creatinine, and water to pass through. Blood glucose that is very high for a long period of time causes damage to the small blood vessels of the kidney and decreases the kidney's ability to filter the blood. One of the first signs of kidney damage is the presence of albumin, a very common protein, in the urine. Some factors increase your risk of developing nephropathy, including the duration of diabetes, significant or long-term hyperglycemia, high blood pressure, dyslipidemia, being overweight, and smoking. Nephropathy is a very sneaky disease. Its symptoms usually appear at the advanced stage. When the kidneys are about to stop working, called end-stage renal disease, the following symptoms may appear: fatigue, weakness, nausea and vomiting, and generalized swelling and itching. As mentioned, the symptoms usually appear at the advanced stage of the disease, when it is therefore harder to treat. It's therefore necessary to take preventive measures, first and foremost by doing screening tests at the appropriate times. For people with type 1 diabetes, screening tests for microalbuminuria, or the presence of protein in the urine, and serum creatinine, a blood test, are recommended at the age of 15 or 5 years after their diabetes diagnosis and every year thereafter. For people with type 2 diabetes, the same two screening tests are recommended at the time of their official diabetes diagnosis and every year thereafter. Screening tests allow for effective treatment to begin quickly when the disease first appears to prevent or delay the loss of kidney function. Your healthcare team may recommend more frequent testing if your kidney function has already been affected. To prevent kidney damage and delay its progression, you need to control these two parameters: your blood glucose as indicated by glycated hemoglobin and your blood pressure. For the majority of people with diabetes, the glycated hemoglobin target is 7% or less. It can be 6.5% or less for newly diagnosed individuals whose nephropathy is in an early stage. To maintain your blood glucose within target values and therefore protect your kidneys, it's important to take your medications as prescribed. Drugs from the classes of angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers act on blood pressure and therefore protect your kidneys. Canagliflozin, or Invokana, is an SGLT2 inhibitor used to delay the progression of nephropathy, even in the presence of good glycemic control. It can therefore be added to anti-hyperglycemic treatment when diabetic nephropathy is discovered. Canagliflozin and empagliflozin, or Jardiance, are used in the treatment of hyperglycemia in people with diabetic nephropathy. Some anti-hyperglycemic medications are contraindicated for people whose kidney function has been affected. Your healthcare team may replace these medications or modify their doses while taking into account the state of your kidneys and your overall clinical situation. This course has been made possible with the financial support of Roche Diabetes Care, a division of Hoffmann La Roche Limited.